Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan and today the topic of our lecture comprises of neuropsychiatry. Now, neuropsychiatry is basically a branch of psychiatry that is dealing with the neurological disorders. When we say the neurological disorders, it's basically triggering towards the disorders that are affecting the central nervous system. So here we're going to discuss these disorders today. In the very first section, we'll be discussing the different brain diseases that comprises the neuropsychiatry. First of all, the definition that is regarding the brain diseases, we'll be discussing them over here in the very first section. And then we'll be moving on to the most prevalent diseases. So epidemiologically or on which the research work has been done, we'll be discussing those diseases first of all on our priorities. So the clinical presentations will be discussed accordingly. What are the general clinical presentations when we are discussing the diseases that are related to the central nervous system? In the second section, we'll be moving on to the most prevalent disease of the neuropsychiatry, which is basically the epilepsy. We'll be discussing the post-concussion syndrome, which is quite mimicking to the epileptic disease. So we'll be discussing that over here, and how do we basically distinguish between the post-concussion syndrome and epilepsy. That will be discussed over here. And then we'll be moving on to the definition of epilepsy or the seizural disorders. Then we'll move on to the causes or the causative factors, as well as the risk factors that add on to the epileptic disease. In the third section, we'll be discussing the types of epilepsy. So there is a variant of epilepsy out there, and one should know how do we distinguish between the grand mal epilepsy, petit mal epilepsy, then we have the partial seizures, we have the absent seizures, we have the complex partial seizures. So knowing the clinical presentations of these complex seizures or the variety of seizures that are available is again very important. The differential diagnosis of these clinical diseases is again very important. How do we go about and treat these disorders is again very important. The investigations that are routinely carried out for the epileptic disorders is again very important. So we'll be discussing all of these factors that are quite significant to any practicing psychiatrist. We'll be discussing that over here in this very third section. In the fourth section, we'll be moving on to the treatment of epilepsy. So the anti-epileptic medications that are routinely used, that will be discussed over here, and then we'll move on to the surgical treatment. So if there is an indication for the surgical treatment, we can treat this disease surgically as well. So the nerve stimulation technique, majorly the nerve that is stimulated for epilepsy is the vagus nerve. So we'll be discussing that over here as well. In the fifth and the final section, we'll be discussing the post-ictal phase. So usually we'd divide this epileptic disease into three major sections. That is the pre-ictal, the ictal disorder, and then we have the post-ictal phase that we have to consider in this patient. The history taking is again very important. The history is taken from the witnesses that were present during the seizure or during the abnormal behavior of that individual that regarded the person to be epileptic. And then the post-seizural treatment is again very important. What are the significant precautions that are taken for the person is again very important. So we'll be discussing these post-seizural precautions as well in this section. So I hope you want to learn more about this branch of psychiatry, that is neuropsychiatry. So do watch the other sections to this lecture as well.